As the COVID death toll crosses 1,000 in Australia, the government is preparing to switch its approach. Up until now, the country has implemented fortress-style controls, closing borders and placing half the population in lockdown. But authorities have dispensed with plans to crush the virus and say that Australians have to learn to live with it. Australia is making that decision even as infections rise. New South Wales Premier Gladys Berejiklian issued the grim warning that October will be the worst month for the state's intensive care units.
Our hospital system is under pressure. Will we need to do things differently? Of course we will. Will we need to manage things differently? We're in the middle of a pandemic, of course. But will we cope? Of course we will.
Australia's early success quelling the virus has been replaced with public frustration at a delayed vaccine rollout. Just over 33% of those aged 16 and older have received 2 vaccine doses, well below most comparable countries. As the wary nation reopens, health experts have cautioned that mask wearing needs to continue. Tourism operators have joined the chorus of mounting anger at the government, pointing to the devastating impact that the restrictions have had on their industry. In the state of Queensland, home to the Great Barrier Reef, Daniel Schwind, head of Queensland's Tourism Council, says local tour operators are struggling. He estimates the state is losing $5 billion a year from international tourism, and as much as $730 million a month from other parts of the country.
We've had cyclones and floods and bushfires and pretty much everything else that you can throw at us, but we've always overcome. But this one is the most profound disruption that we've ever faced because, most importantly, there is no immediate end in sight.
Meanwhile, business owners in Sydney, which has been the epicentre of the Delta outbreak, are still grappling with a loss to the bottom line after 3 months of restrictions.